Okay, is there any doctor with me? Any doctor? Is there any doctor with me? You can unmute, please. Any doctor? Just 1 minute, please. Okay. Okay, so let us wait for doctor. We will do one for doctor and then we will continue with nurses. Okay.
Hello. Hello.
Yes, please. Can you hear me?
Yeah. Am I audible?
Yes, yes. Thank you.
Yeah. So I'm a doctor. I want to practice.
Yes. Yes, no problem. Yeah, let us do.
Okay. Can we have a role play card?
Yeah, I will show you just 1 minute.
Okay. Till then, I'll mute myself.
Okay, okay. Okay, doctor, can you see my screen?
Yeah.
Could you please turn on your cam, please?
Okay.
Okay. Thank you. Thank you,
Am I
doctor.
visible?
Just just adjust a little bit on right side. Yeah, on the center, in the
Okay.
center, please. Okay.
Now.
Oh, yeah, now good. Thank you. So, doctor, this is your role play.
Okay.
Okay. So you have like the real exam. Let me start recording. Okay, just 1 minute. Okay. Good morning, good evening, doctor, nurses, and pharmacists. I'm Dr. Che, and today we will do one speaking role play with Dr. Khan. So, doctor, like real in the real exam, we will have the role play like this. For example, if you are doing face to face, okay, the examiner will read some instructions. Will do warm-up session. This is a separate discussion. So after that, they will give you this role play. You will have 2 to 3 minutes to prepare. If we are doing on the Zoom, okay, online, like if you go for OET home or if you go for OET on computer, so then it will be just like as we are doing. Okay, you will see your role play here and you will be doing the role play like this. Okay, so now you have 2.5 minutes. Okay, to prepare for this role play. Your time starts now.
Okay.
Let me know, doctor, when you are ready, please. Please unmute. Can we start?
Yeah, I'm ready.
Okay. Okay. Start, please.
Hi, I'm Dr. Khan, and we are going to perform a CPR on you. Are you okay with it?
What, doctor?
Hello?
Yes, doctor. Can you hear me?
Yeah. Could you
Start
please
again,
confirm?
please.
Am I
Start again, please.
okay? Hi, I'm Dr. Khan, and we are going to perform CPR on you. Are you ready for that?
Yes, doctor, I'm ready.
Okay. I would like to ask you a few questions about this. Do you have any concern about this procedure? Like,
No, doctor, I was in the hospital. I have seen many doctors doing, they were just climbing on the patients. But I don't want this procedure, please.
yeah, I really appreciate your concern, but let me explain you about this procedure that it's like a life-saving procedure. It will help you if you have a compromise in blood supply, or if you are really facing a difficulty in breathing. So it's a life-saving procedure. So I highly recommend you to go with it.
But you know, doctor, I have this cancer. I will not live too much, doctor. I want to die with dignity, doctor.
No, let me reassure you that cardiopulmonary resuscitation is a procedure which really give a new life to the patient, so that it enhance your rate of respiration. Are you getting my point?
Yes, doctor, but I want to die with dignity, doctor. Don't want this.
Okay, as of now, as you are very really concerned about this procedure, so as of now, you need to sign a procedure called DNA CPR, and it stands for Do Not Attempt Cardiopulmonary Resuscitation. Are you getting my point?
Yes, doctor, I can sign.
And let me give a clarity about that. Later you can reverse your decision, like now how you are signing for DNA CPR, and later if you wish you could go with this procedure, and it's upon you. But I will recommend you to go with this procedure. It's really a life-saving procedure.
Okay, doctor, thank you. But I don't want at the moment, doctor. I will think in future.
Okay, I really appreciate your concern, but it's upon you whether to take a call or not. Okay, I
Okay,
hope you will get well soon. Thank you.
no, doctor, I will not get well soon. I have cancer.
I wish you could have cured this disease.
Thank you, doctor.
Thank you.
So, doctor, you have done your role play. Okay, just continue with video, please. Don't worry. I will explain you. Then you can. Okay.
Okay.
So you have done your role play in less than 5 minutes.
Okay.
Okay. So, doctor, nurses on Facebook, please let me know how much time we should spend uh, on role play. Do you know, doctor? How much time?
Yeah, it should be around 5 minutes.
Around 5 minutes. Okay. Okay. So I think this is your first role play, or
Yeah,
you have
actually,
already done.
no. This is my first role play. I'm going to appear my OET on 24th of September next month.
Okay, doctor. So you still have time. Actually, here we have certain criteria that we need to meet. Okay. This is just not talking to the patient. So I have one YouTube video in which I have explained uh, assessment criteria for speaking. So please, if you have time, go through that so that you know how to approach role play and what are the criteria we need to fulfill. Okay.
Sure.
So
I'll
let
go
us
with it.
start. Let us start with preparation time. What you have done in preparation time, you didn't throughout your role play, you have not used my name. You didn't even ask my name. Okay. So it means you are not building good rapport. How you can get, if I am saying today I am going to do one role play with Dr. Khan. Even I did not ask you, but I have seen on your, this behind your video that your name is Khan there. So this is to build good rapport. If I call you by name, so you will feel happy or not.
Yeah, yeah.
Okay. So we have three options for the to ask for the patient. So you can ask my name during preparation time, option number one. Option number two is at the start of role play, you can ask my name. This is option number two. Option number three is in OETs, you can use any general name for me, but you can call, is it okay if I call you Smith in the role play? I will say yes, but during the preparation time, not after your time starts. Okay. So done with name. Okay. Now next is you started, your greeting was not good. In OET, it is very important that your greeting should be according to the situation. You will see, you told me that we need to do CPR on you. Is it okay? Can we talk? Okay. You are not going to do CPR on me. Okay. This is just, I am giving you an advanced plan. This is advanced planning. Okay. If patient denies to do CPR in future at any time, if I need, you will see, go to my notes. So it is written that you don't need to attempt CPR when I need it, but not now. So your start was not good. Okay. So this is just like for you, it is like new patient. So how you will greet this patient? First, you need to introduce yourself. Good morning. I'm Dr. Khan, one of the doctors here in this suburban clinic, or you can say in the hospital. In this case, it should be hospital. So I'm one of the doctors here in the suburban clinic. So is there anything, I can see that you are admitted here. Okay. Uh, or you can see, is there anything I can help you with? Or Mr. Smith, you wanted to talk with me. How can I help you today? Something like that you need to tell. Okay. Then the patient will say, doctor. Now the patient will tell, doctor, I don't want CPR. Okay. So what should be your next question?
Why? What things makes you worry about this procedure?
No, you will ask, Mr. Smith, could you please tell me, very, very polite, okay? You can unmute yourself, that don't worry, okay? So, so you will say, Mr. Smith, could you please tell me why you don't want us to do CPR, okay? Doctor, I have this cancer and this and that, and doctor was jumping on patient, this and that, okay? Okay, yes, Mr. Smith, you can decide about your own health. Okay, it is not obligatory. What you can take what you want. Okay, you can decide about your health, whatever you say. Okay, but could you please tell me, do you know what is CPR? What is CPR? Okay, so now you will tell me what is CPR, but you will not use any medical term here. Okay, so you will not use any medical term here. Okay, just in simple words. Okay, then you have explained me what is CPR. No, you just need to check uh, understanding of the patient. You just need to do what is written here. This is not medical exam, okay? Could you please tell me, Mr. Smith, what could happen if we don't do CPR if you need at any time? Then I will tell you, doctor, I know I will die, okay? Then okay, so then you will tell me that if you need it, then we need to sign this form. Okay, so then just tell in good way. Okay, then at the end, Mr. Smith, one more thing. Just let me tell you one more thing, Mr. Smith. At any time, this is not, at the moment, this is your decision, final decision. But if you wish at any time, you can change your decision. If you change your mind, you can change your decision. Okay, this is very important to tell at them. This is the doctor how we need to do the role play to get B grade. Okay. The way you
Okay,
have
sir.
done, your English is very good. Okay. But the way you have done is clearly C. Okay,
Yeah,
but
I
now
can.
you will show us, how to do B grade, the same role play. Okay, start please.
Shall we continue with the same role?
Yes, you can take 30 seconds to think. Okay.
Okay.
This is your preparation time. You can ask my name if you wish.
Okay. Could you please tell me how can I address you?
You can call me John.
Okay, John. Thank you.
Okay, now you can start. Okay, start please.
Okay. Hello, John. I am Dr. Khan, and I'm one of the doctor in this hospital.
Good morning, doctor. Can't hear you, doctor.
Now, I think now it's your turn that you should tell me.
Okay,
I don't want
okay,
to.
just
Yeah.
continue, please. Good morning, doctor.
Yeah, Mr. John, uh, what's your opinion about this CPR?
No, doctor, this is not good question.
No, actually, sir, I thought it's
Okay,
about
start
your
again,
turn to
please.
tell.
Start again, please. Again.
I need to ask a few questions. Could you please
No,
clarify me?
just start from zero, please.
I mean, after
Okay.
greetings,
Just
is there
start greeting,
one?
please. Please start greeting. I will tell you. Start greeting.
Hello, Mr. John. I'm Dr. Khan, and I'm one of the doctor in this hospital.
Good morning,
How are you?
doctor.
Yeah, how are you doing today?
Just, doctor, I'm suffering a lot with this cancer, doctor. It's not easy, doctor, to live with this cancer, doctor.
Yeah, it must be really stressful for you. Sorry to hear that.
Thank you, doctor. Now, ask me, Mr. Smith, Mr. John, is there anything that I can help you with?
Okay, Mr. Smith, could you please tell me how can I help you?
No, how can I help you? No, it is late, okay? If there is anything else, if there is anything that I can help you with?
Okay, Mr. Smith, uh, is there anything that I can help you with? It?
Yes, doctor. I have seen in the hospital many doctors doing this procedure. I don't know. They were jumping on the patients and compressing on the chest. Doctor, I don't want this procedure for me. It is very painful.
Oh, Mr. John, I really appreciate your concern. But could you please tell me, do you what all you know about this procedure?
No, why you don't want this procedure? The reason, first bullet point, reason for this.
Okay, could you please tell me what things really bother about this procedure? Why you don't want this procedure?
Doctor, I have seen many patients dying even with doing this procedure, and it was very painful for many patients. Even some patients got fractures of their ribs. Doctor, I don't want this.
Yeah, Mr. John, I can understand your concern, but I would like to ask you that do you have any idea about this procedure?
No,
So
doctor,
for
what is this?
Okay, let me explain you, Mr. John. This procedure is so-called CPR, and it stands for cardiopulmonary resuscitation, and it's basically a life-saving procedure. Like it stimulates the patient's heart to beat and supply enough blood, and it stimulates the respiratory system of a patient. Are you getting my point?
Yes, doctor, but I don't want this, doctor. It is very. I have my cancer, doctor. I want to die with dignity, doctor. I have already cancer, doctor. I will not live so long.
No, Mr. John, we are working for that to cure your disease. But let me explain you about the CPR that it's a really a good procedure. It's sometimes called as life-saving procedure because it will stimulate the patient's heart and respiratory systems to breathe effectively.
Yes, doctor, that is good, but doctor, I don't want this, please.
Okay, Mr. John, I can understand your concern, but for this, if you don't want to go with this procedure, so you need to sign a form. This
Doctor,
is not.
third bullet point, third bullet point.
Uh, okay, let me tell you that when you do a CPR on a patient, it help in stimulation of heart and
Doctor,
help in.
third, this one. You ask me, Mr. John, do you know what could happen if we don't do CPR for you?
Okay, 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 sir.
If it is not done,
Okay,
okay?
okay, okay, Mr. John. Uh, do you know if we won't do this procedure on patient, do you know what all can happen to patient?
No, doctor.
uh, he may die because of because of cardiac arrest or stoppage of respiration. So I
Doctor,
highly
that is not
recommend.
a problem. That is not a problem. I want to die with dignity, doctor.
Yeah, I can understand your concern, Mr. John, but the opinion what you have about this procedure is really not that much what you're thinking. It's
No,
really
no,
a life-saving
don't be
procedure.
judgmental. Don't be judgmental, please. Don't say me that. No, it's judgmental thing, okay? Now you go
Okay.
for the next bullet point. You don't need to add too much things from your own. Just go to next bullet point. Just tell me you need to sign a form and this thing.
Okay, Mr. John, if you have decided not to go with this procedure, so you need to sign up a form called DNA CPR, and it stands for Do Not Attempt Cardiopulmonary Resuscitation. Is that clear
Yes,
with you?
doctor. Yes, doctor. I can do that. I don't want CPR, doctor, please.
Okay, now you can sign, but let me give a clarity about that. Uh, in future, you can reverse your decision that whenever you want to go with the procedure, you can go with it. It's not an hard and fast rule that you have signed, you should not go with it. It's not like that. In future time, when you have decided to go with the procedure, you can go with it.
Okay, doctor, thank you. So if I change my mind, I will let you know, but no, I will sign the form, doctor.
Okay, it's upon you. Have a nice day. Get well soon.
A nice day, no, doctor. I have cancer. I'm going to die. A nice day, no.
Okay,
So, is there anything else, Mr. John, I can help you with? Okay.
okay, Mr. John, is there
Are
anything which can help you?
yeah, are you do you have any other concern, Mr. John? Something like that. Okay. So overall, doctor, your English is good. You will not have any problem. Your pronunciation is okay, grammar is okay, fluency, your fluency is okay. So we have two criteria. If you go to assessment criteria, you can watch my own YouTube channel. So in speaking assessment criteria, we have two parts. One is linguistic, number is clinical communication. Linguistic wise, you are doing good. And clinical wise, it means showing sympathy, going step by step, and rapport, and all of these things. Clinical criteria we need to improve. So just you need to practice, okay, doctor. So you will easily get your required score. Okay, your English is good overall. This is how you can see you can make some speaking partners with other doctors having the same exam date. So you can do practice with them, or you can get some feedback from any. So no nurses, who was the first one? Let me.
Yes,
Doctor,
doctor,
can
I
I
want.
stop my video and
Yeah.
let
Thank
me?
you. Yeah,
Okay,
thank
thank
you,
you.
doctor, for.
Thank you.
Yes, doctor, I want. Can you hear me?
Okay. So just let me. Yeah, just let me see who is this with the last number is 026. It was the first one
Yes, it's
to
me.
ask me. Okay, so you can turn on your cam, please.
Yeah, sure.
So, doctor, if you
Am I
want to
visible?
continue, yeah, thank you. Just adjust a little bit, please.
Actually, I cannot see my picture.
Okay, so I will let you know how we can adjust a little bit.
I don't know. I cannot see myself.
But you have disappeared totally.
My camera is open.
Before that, yeah, now it is okay. Yes, your back cam, no, doctor, please, miss.
It's back. Actually, I cannot see. I don't know why. Hello.
Just keep in front of you. It would be, yeah.
How?
No, nothing.
Actually, I
I
cannot
think
see myself.
maybe you are using back cam. Yeah, now it is
My,
okay. Now is yeah, is okay now. So let me see. Okay, so now you have gone.
I'm here.
Okay, so this is your role play.
Okay.
2 minutes. Okay, just let me start a little bit greeting and then. Good morning, good evening, doctors and nurses. So I'm Dr. Che, and today we will do this role play with one of our nurses. So this is your role play. Like in the real exam, you will have 2 to 3 minutes to prepare. So you have 2 minutes to prepare for this role play, please. Let me know when you are ready, please.
Yes.
We cannot see you. Okay, now okay. So start, please. Start, please.
Just wait. May I start?
Yes, please.
Hello, my name is Kiran. I am one of the registered nurse today. Can you please tell me how may I address you?
Yes, I am Jenny.
Jenny, can you please tell me what brings you here today?
You know, Nas, the problem is you can see my this 3-year-old son.
Yes. What's
Uh,
bring you here today?
uh, let me let me finish. Okay. So the problem is, nurse, you know, yesterday uh, he had a fit. That is why I'm here.
Yesterday he was fit, as you said that. And what's going on right now?
Yes, he was having convulsions, fits, doctor. Fits yesterday.
I am really sorry to hear about that your son is suffering from the fits. Could you please tell me more about that? Have you noticed anything else with the fits, like fever, cough, or anything else?
Uh, yes, he was having fever. Uh, fever and yes, flu, a little bit cough also. Yes.
Let me reassure you that it can happen with this, but would you mind telling me if he lost his consciousness or
Uh,
was awake at that time?
yes, nurse. Yes.
Did he pass urine during this episode?
Yes.
Thank you so much for answering my question. That you told me that he was suffering from the fits with the fever and cough, and he also lost his consciousness and he passed the urine. Am I correct?
Yes.
Now I want to just know about your family history. Is there any family history of fits?
Yes. His father has epilepsy.
I am very sorry to hear about that. Can you please tell me, do you have any other questions or concerns?
No, just I don't know what is happening with him.
I can accept your worries. It's very difficult for you. If I would be at your place, I am going to feel the same. Let me reassure you that it's not epilepsy, and it's very treatable. So you don't need to be worried about that. Are you with me?
Yes.
We are here to help you, so you don't need to be worried about. We will prescribe you some medications, antipyretic for fever. We will give you the paracetamol, and you don't need to take aspirin. Are you following me?
Yes.
Now I am going to tell you some more about the preventions, that you have to take medications on time. And if he fall down, you just make sure that there would be no any hard surface, and just turn your baby's side. Are you with me?
Yes, I'm with you.
One more thing I want to add, that if he lost his consciousness more than 5 minutes, you just need to rush to the emergency department or call to the hospital. Are you with me?
Yeah, I'm with you. Yeah.
I'm very glad that you are understanding well. Do you have any other concerns and queries?
No.
Thank you so much. So I'm going to leave now. If you have any other concerns, you can just buzzer the bell and I will be
Yeah.
right back to you.
Okay. Thank you.
Thank you so much.
No, thank you. Yeah, you can still continue your video. I need to explain you.
Okay, sure.
Okay. So overall, what I have noticed that you are a good, and you're confident in your role play. That is good thing.
Okay.
English wise means pronunciation, and overall it is almost okay. There are some grammatical mistakes, but just a few, not too much.
Okay.
Uh, but overall, the main thing is again the same. Okay, so we have two things in linguistic criteria. I
Mm-hmm.
will say that only you need to work a little bit on grammar. Okay, tenses especially in the
Okay.
linguistic criteria.
Mm-hmm.
There are some tenses. I will tell you what I have written here. So, but in clinical communication criteria, you have watched my last feedback with doctor. You have tried to cover these things. That is good, but still still we need improvement. Okay, so you have
Okay.
asked me 2 times what brings you here today.
Yes.
Okay,
Yes.
so just when I start telling you something, you need to wait for my response. I was just saying, nurse, you can see my this 3-year-old son. Then after that, I will say my problem. Okay, my son's
Yeah.
problem. But you started. Then could you please tell me what brings you? Okay, this is not good. You have interrupted the patient. Okay.
Yes. Yes.
Okay. So when I say okay, when I told you, nurse, you can see my this 3-year-old son, and he yesterday had a fit. So yes, I can see. So I can see that's something that you can tell me that I can see your child this and that. Then one thing you have misunderstood. Yesterday he had a fit. Okay, this fit means convulsion. So you have just changed. That means he was fit yesterday. So it means you have misunderstood here one thing. Okay. Then very good. I was expecting that you are doing very well when you told me an open question. You know what is open question?
Yes.
What
Like
is?
elaborate. Like more elaborate something.
Yeah, could you please tell me more about your son's condition? But I was happy when you have done this. I was happy. Okay. But you know what happened then?
No.
You have added closed question with the open question.
Okay.
You told me, could you please tell me, Miss Jenny, one more thing that I have remembered, just keep using name of the patient throughout your role play, please, okay? You didn't tell me, Miss Jenny, just you have asked my name, but you have not used my name throughout the role play, okay? So this is
Okay.
this comes in the repo, okay? So this is not good repo, okay? You asked me, could you please tell me, you showed me sympathy, sorry for that. Could you please tell me more about your son's condition? Then you added a closed question. Had he was he having fever, cough? Okay, something 2 or 3 questions you have added there. Okay, so number
Okay.
one, you asked me open question, then you added closed questions. This is not good. Keep it open. Could you please tell me a bit more about your son's condition? It means you keep it open, then I can tell anything that I want to tell. Okay. This is
Okay.
one thing. Number two, you asked me more than one thing. You have asked me cough, you have asked me fever, any other thing. So this is called compound questions. Don't
Okay.
ask compound questions, okay? One thing, okay?
Okay. Sure.
Okay, so one thing. Maybe you ask me, I will tell you about convulsions. So about fits. Then you can ask me, uh, uh, did he have fever? Or does he have fever? So you can use present and past, both are okay. Then you can ask about cough. Then you asked about loss of consciousness. So did he loss of consciousness? No, did he lose consciousness? Did he lose consciousness? So you told is he lost consciousness? So this was grammatically wrong. So then
Yes.
did he pass urine? This was grammatically okay. Very good. You are asking separately. Loss of consciousness separately. This one separately. Okay.
Hmm.
Then you ask family history, that is good. Then you told me, so do you have any other concern? That is very good. I asked you, I don't know what is happening. So you are involving me, the patient in the conversation. So in first 3 bullet points, in the last 2 bullet points, you didn't involve me. You just, are you with me? I told you, yes, I'm with you. You keep explaining, you kept explaining. I was just listening. You just ask one thing at the end. Are you with me? I tell you, yes, I am with you.
Okay.
Yeah, okay.
Yes.
Okay, so please involve the patient in the conversation, okay?
Okay. Sure.
So the next thing is here, you told me that, you have reassured me, you told me it is not epilepsy, but you didn't explain me. You didn't explain me what is this? Febrile
Okay.
convulsion. You did not explain me what is febrile convulsion. So it is not epilepsy, then what it is? It is febrile convulsion, okay? So then you just don't need to keep explaining this. You can ask me, okay, Miss Jenny, do you know what you need to do in case if your son has has any future any fits in future. Okay, I will say no doctor,
Okay.
no nurse, I don't know. Then you will explain me. It would look very good. Okay, this one. So then explain this slow. Maybe you divide it into two parts. Divide into two parts.
Mm-hmm.
Why I've written a lot of information here? Just to check whether you people divide it into two parts or not. You can ask about this medication, move away from danger. Okay, you can ask these dangers. Okay, then stop here. Okay, then you can say cushion the head and turn on the side. Okay, okay, after
Okay.
stopping the conversion. So in parts, in chunks. Okay, then the
Mm-hmm.
last is you only mention if he has fits for more than 5 minutes, you should rush to the emergency. Okay, it's not emergency, just call the ambulance. Or if he does not regain the consciousness, or he is seriously injured during the episode, so you need to tell all the complete information. You have completed your role and your role play in 4 minutes and 15 seconds. So please,
Okay.
if you don't cover all the things, you will finish before time. Okay.
Mm-hmm. Okay.
So overall, just you need to work on these things. Overall, you are close to your B grade. Okay, just work on these things, please.
Okay, sure. Thank
Okay,
you.
thank you so much. Thank you.
Thank you.
So okay, so now let me just 1 minute, please. Next nurse with me. Next one was Miss Susie. Okay, Susie, whatever. Okay, sorry for mispronunciation. Can you hear me? Are you there? Maybe Miss. Okay, just turn on your cam, please. Thank you. So let us do card number 9. Okay. Good morning, doctor, nurses, and pharmacists. I am DrChe, and today we will be discussing this nursing role play. Even if you are doctor or nurse or pharmacist, you still can get benefit. But overall, your marking criteria means linguistic criteria, clinical communication criteria. Both of the things are same. Overall case is also similar. So both of you, all of you can get benefit. So, Miss, this is your role play. Like in the real exam, you will have 2 to 3 minutes to prepare, and then we will start the role play. So you have 2 minutes to prepare for this role play, and then we will start the role play, please. So you have asked me in the chat, so you should ask me directly, okay? Don't ask in the chat. So unmute yourself, please. So you asked me, how can I call you? So you can call me, let us again say Jenny, okay? So please unmute, please. I can't hear you. Unmute, please.
Hello, sir. Can you hear
Yes,
me?
now I can hear you, okay?
Okay, sir. Okay, sir.
So can we start?
Yes, sir.
Okay,
You can start.
yes, start please.
Hello, good morning, Jenny. I'm Susan, one of the registered nurse working in this hospital. So, how are you feeling today?
Doctor, a nurse,
Hmm?
I'm not feeling well. My child is sick.
Okay, well, I can see that. I feel that some sort of that like jaundice-like appearance in your daughter. Is it something like that? I can see.
Uh, yes.
Okay. So are you concerned about that? I feel by looking you, you feel a bit concerned about something.
Yes, I'm concerned about the same thing, miss, this is my first child, and
Okay, Jenny.
yes, and this is baby boy, and my husband, loves him so much, but
Okay.
he is getting sick.
Okay. All right. See, Jenny, don't worry about that. Your son will be perfectly all right within couple of days.
Thank you so much.
Okay. Have you noticed anything except this condition?
No, just he is becoming pale.
Okay, all right. So, do you mind if I ask something, some questions with you?
Yes, please.
Okay. Does his breastfeeding perfectly? Feeding good?
Yes, he was feeding very well, nurse, but
Okay.
since I noticed his color was becoming pale, then I talked to one of my friends. She also
Okay.
has 3 kids, and then she
Okay.
told me to stop breastfeeding.
Okay. All right. I can definitely understand your concern, but don't worry, Miss Jenny. It's totally, absolutely normal in many of the kids I have seen. So don't worry about that. But don't kindly don't stop breastfeeding. You continue feeding your child, and it will gradually subside. I hope you are following me.
Yes, miss, yes.
Okay. So can you please tell me how frequently you feed your child?
Yeah, I was feeding, and whenever he started crying, I was feeding, but no, I'm not feeding. But before
Okay.
that, I was feeding very frequently after 1 hour, after 2 hours.
Okay, all right. See, Jenny, I would like to say that this breastfeeding is very important for your child during his initial stage because it increases your immunity. So, and it also promote him to get less infection. It's very important for him to get a proper nutrients and minerals that only he can get from your breast milk. I hope you can able to follow me.
Yes.
Okay, all right, Jenny. And do you have any other concerns?
Uh, no, what is happening with him?
See, it's a normal phenomenon. It just happens to many of the child, but it will definitely under control within 2 to 3 days. Actually, what happens, liver function may change, and some child will not adapt that things. So it will gradually subside within couple of days.
Okay, miss.
Okay.
Thank you.
So, okay, for that, I would advise you a few measures. May I proceed with that?
Yes.
Okay. See, Miss Jenny, you can take your child to outside, like sunbathing. You can provide that will also help. In the morning time, you can give, and as well in afternoon for 15 minutes. 15 minutes, you can provide sunbathing to your child. That will also help to control the jaundice level. Is that
Ah,
okay?
okay, miss. Thank you. I will do that. I will go outside and then I will put him under sun. Thank you.
Okay. Okay, Jenny, and don't worry about your child. He will be perfectly all right. And I hope I have cleared that doubt. And is there any other concern which I should clear with you?
No, miss. You are very good, miss.
Okay, Miss Jenny, I hope your child will recover soon. And I hope, and is there any other concern, you should definitely call me and I will be there at any moment. So have a nice time with your child. Bye, Miss Jenny.
Okay, thank you. Thank you.
Thank you.
So, one of the things that I have noticed in nursing role plays, maybe due to because you people see on YouTube, there are many sample role plays and they keep teaching, these just memorized word. Do you follow me? Okay. So mostly I see this in the nursing role plays. Okay. So just one example. So there are many fillers that many nurses just keep using because they have memorized it. But we will less
Okay, sir.
likely see in doctor's role play because they do like in the real, they see the patient. Okay. So
Okay.
please just keep it natural. Okay. Don't tell the things that are just memorized and okay. So
Okay, sir.
getting involving the patient does not mean asking, do you follow me? Are you with me? This does not mean,
Okay, sir.
okay, you are involving me.
Yes, sir.
Okay. So
Okay, sir.
for example, so here you have told me, you have advised me. Okay. So I told you I
Yes,
have
sir.
started breastfeeding. Okay.
Yes, sir.
Then first you need to reassure the mother that breastfeeding is not the cause of this issue, and then you will advise me that you should continue breastfeeding. Okay.
Okay, sir.
Okay, Miss Jenny, let me reassure you that uh, this is normal. As I told you, you should have already explained me this is normal and these things. Okay. So
Yes,
as
sir.
I already told you that this is a condition, this type of jaundice is quite normal at this
Yes, sir.
stage in the first 2 to 3 weeks of age. Okay.
Yes,
But
sir.
this is not due to breastfeeding. So breastfeeding is not the cause of this issue. So I would highly advise you to continue breastfeeding.
Okay, sir.
Okay.
Okay, sir.
I'm asking, are you with me? Do you follow me? You can ask 1 or 2 times. That is not a problem. Not frequently. Okay. So
Okay,
I
sir.
would highly advise you to stop breastfeeding. You stop here. Okay. Stop
Okay,
here.
sir.
Don't start discussing the advantages of breastfeeding.
Okay, sir.
What you will do?
Yes,
You
sir.
will
What is?
advise me. You will
Yes, sir.
advise me. Stop. I would advise you to continue breastfeeding. Okay.
Okay, sir.
Then you will
Okay, sir.
pause. When you pause, it gives opportunity to the patient to ask anything if he wants.
Okay.
So you will pause for 3-4 seconds. If I don't ask you anything, then you can go to the next point. Okay.
Okay, sir.
So you have told me, so you should continue breastfeeding. You have stopped. Okay. So if I don't ask you anything, what you will say? How you will involve me? How you will
Sir,
involve me?
I will ask that whether I could add something to it, or I
No,
will ask.
don't ask general things. Please be specific.
Okay, sir.
Yeah, what you will add?
Sir, how may I
What is
help
your
you
next point?
further?
What is your
Okay.
next point in the card?
I
Please
will.
see
I
the
will.
card.
I will give the advice. Advice
After
is
advice, you will need to tell
after
the
advice.
advantages of breastfeeding. Okay.
Yes, sir. I will
You
give
can
the
ask.
advantages.
If I ask you, nurse, what are the benefits of breastfeeding? If I ask
Okay.
you, you just explain. If I don't ask you, you can ask me, Miss Jenny, do you know what are the benefits of breastfeeding? No, nurse, I don't know. You're involving me. You're not just asking, are you with me? Do you follow me? You're not asking this, okay? You're asking,
Okay, sir.
Miss Jenny, do you know what are the advantages of breastfeeding? I will say, no, no, miss. Then you will explain. Yeah, okay, let me explain you, Miss Jenny. Actually, our breast milk has some important things that increase immunity of our children, and that is why they will have less infections. You need to join these things together, these three things together, okay?
Okay, sir.
Then they will have less chances of infection in future. and one important thing is that our breast milk contains balanced amount of minerals and proteins that are highly beneficial for our kids. You can see how it is
Okay,
easy
sir.
for me to understand if
Yes,
you
sir.
explain me like this.
Yes, sir.
Okay, so last point you have done very well. Let me tell you one thing here. After this, you didn't ask me, here it is jaundice. I will say I have noticed pale color of my son. So could you please tell me exactly at which part of body or where you have noticed the pale color? Maybe it is only on face, maybe it's on whole body. Okay, it's very important. Okay, ask the
Okay.
site. Duration, since when you have noticed the pale color is very important question. Okay, it is something
Okay.
little bit about doctors, but still if it is written you can ask. Okay,
Okay.
so in UK nurses are not just to give the injections, not give the doses. Even some nurses are GP practitioner like doctors. Okay, so don't
Okay.
expect you are only injecting the medication. So there you are almost like a doctor. Okay, so you will ask any other symptom like fever. Okay,
Okay,
then
sir.
you need to explain me, you need to reassure me. Well, just before that, no, before that, you told me that I can see that your son has jaundice, is pale. Don't ask me this. Don't tell me this. Ask me, how can I help you? I can see, Miss Cherry, I can see that you are here with your little kid. Could you please tell me, how can I help you? You have mentioned the kid. You can mention the son. I can see you are here with your little son. Okay, even you can ask the
Okay.
name of the son. I can see you are here with your little David. Could you please tell me, how can I help you? Don't say I can see that he is pale and then what is your concern? Is this your concern? No, no. You need to ask me, okay?
Okay, sir.
So second bullet point, you need to explain me, reassure me, okay? Then I will calm down. Then you need to ask about breastfeeding and these things, okay? So
Okay,
please
sir.
focus that the things should be easy for the reader to understand. Whatever you explain should be easy for me. Involve me in the conversation. Okay, don't just keep
Okay.
saying, do you follow me? And just a few memorized phrases that nurses learn from YouTube and here and there, and they keep saying again and again. Okay, when I ask nurses, okay, could you please tell me before I join you in the group, WhatsApp group, send me voice record. So when you say, so nursing is a noble profession, this is the first word they say, nursing is a noble profession. So this is just memorize thing. Okay, so please be natural, as
Yes,
natural you
sir.
will be. So you just need to keep in mind that you need to make it easy and clear for the reader to understand, for your patient to understand. Go step by step. Even you have finished the role play before 5 minutes, 4 minutes and 40 seconds. Okay. Okay. So
Okay, sir.
thank you so much. I think
Thank you,
it will
sir.
help you a lot for your next role plays. Okay. So
Okay, sir.
please
Thank you,
keep
sir.
natural, nurses. Please keep natural. Okay. Don't use memorized phrases. Okay. So, now next You can turn off your cam if you wish. Thank you so much for participating. I hope other students will get benefit when they will watch this on YouTube. So next is Miss Bagia. Okay, are you with me?
Yes, sir. I'm here.
Okay, so if you can turn off your cam so that I can show you the role play. I cannot see you. Okay, I can see you. Thank you so much. So okay, so just let me do a little bit greeting and these things for my recording, and then you will start preparation. Good morning, good evening, doctors, nurses, and pharmacists. I'm Dr. Che, and today we will be doing this nursing role play with a nurse. But please remember that this feedback and this role play is not only for doctors and for only nurses. So doctors and pharmacists, all of you can get benefit. So like the real exam, you have 2 to 3 minutes to prepare for this role play, and then we will start the role play. Okay, can you hear me? Can you hear me?
Yes, sir.
Okay, 2 to 3 minutes to prepare for the role play, please. Dr. Nadeem, these are not same. There's a little bit difference, but as I prepare myself, so I just do some changes. Nurses will not prescribe antibiotics, but they can advise the patients about antibiotics and these things. So almost are similar things, Dr. Nadeem. The main thing is your linguistic criteria, your clinical communication criteria for both doctors, nurses is the same. Please let me know when you are ready, and I cannot see you. Can you hear me? Can you hear me? Can you hear me? Miss Bhagia, can you hear me?
Hello,
Other
sir.
people, yes, can you hear me?
It's not clear. It's not, yeah, I can hear, but not
Okay,
clear.
okay, let us try. But I can hear you clearly. Could you please turn on cam, please? Okay, thank you. Can we start? Are you ready? Let me know when you are ready, please.
Okay, sir, okay.
We should start. It's too much time. Okay. Okay.
Hello, good
So
morning.
you can start, please. Now.
Hello, good morning. My name is Bhagya. I am the one of the nurses here. Could you please tell me your name?
Uh, yes, nurse. I am Smith.
Okay, Mr. Smith. I am going to be caring of you now. May I know the reason for your visit?
Uh, yes, miss. You know, I came here 2 days ago,
Yeah.
and I was just having a sore throat.
Okay.
Yeah, but you know, nurse, it is not improving.
Okay, Mr.
Smith.
Okay, Mr. Smith. May I know? Uh, may I know?
Yes,
Hello.
please. Yes. Yes, please. Can you hear me?
Hello, sir. Can
Yes,
you hear
yes.
me?
Continue. Continue, please. You can continue. Other nurses can hear me. Other people on with me on Zoom can hear me.
Yes, doctor.
I think she is having problem with the connection. Okay, let us wait a little bit for her. Can you hear me?
Yes, doctor.
Let us wait for her. Okay. So who has not done role play so far?
Sir, me. I'm waiting.
Okay, so let us wait for her. If she responds, then we will continue with her. Otherwise, I think she is having problem with internet connection. She has left. Okay, so you can prepare the role play.
Okay, doctor.
Could you please turn on the cam?
Yes, doctor.
Okay. Okay, thank you, miss. So just let me. So other student got problem with internet connection. So this is your role play. You have already seen it. Just 1 more minute to prepare, please. Then we will
Okay.
start. Okay.
Yes, doctor. I'm
Are you
ready.
ready? Okay.
Yes, doctor.
Okay. You can start, please.
Hello, good evening.
Good
Good evening.
evening.
My name is Mubini Khalid, and one of our registered nurses working in this suburban clinic. So nice to meet you again, Mr. John. Could you please tell me how are you feeling now?
Nurse, thank you for asking. So the problem is, as you remember, I was having this sore throat 2 days ago.
Okay.
But
Yes.
nurse, I am here because it is not improving. I'm getting
Okay.
worse. Yeah.
Okay. Okay, Mr. John, before proceeding further, I would like to ask you some questions regarding the progress of your condition. So, may I?
Yes, please.
Okay, Mr. John, could you please tell me, do you have fever?
Yes, a little bit feverish.
Okay, so do you have cough?
Nurse, no, I don't have cough.
Okay, is there any pain while swallowing?
Mm, not too much.
Okay, thank you. And do you feel any shortness of breath?
No.
Okay, well,
Are you doctor
Mr.
or
John,
nurse?
I'm nurse.
Okay, great, great. Okay, continue.
Okay, thank you. Thank you for answering my questions, Mr. John. As according to your answers, and that we send the swab, that I would know that your diagnosis is only viral tonsillitis. So, do you know regarding the viral tonsillitis? Do you have any idea?
No, no, nurse, what is this?
Mr. John, there's no need to worry because now you are in safe hand and set your mind at ease. I will explain you. Actually, this is the inflammation of the tonsils, like in the throat, and the cause of this inflammation is the virus. There's no bacterial infection. So,
But
but
nurse, I need, please tell your GP dad I need antibiotics, please.
Well, Mr. Jones, your concerns is considerable, but I would like to assure you, in your case, that you are suffering with the viral tonsillitis. So in this case, there's no need to take the antibiotic, as it can be you can prevent your problem with some other measures. So if you like, I will provide you some other measures that you can do. So may I?
Nurse, I need antibiotic. One of my friends had similar problem, sore throat,
Okay,
just two
okay,
weeks ago. And nurse, he was prescribed antibiotic by his GP, and
okay.
then his condition improved very quickly.
Okay, well, Mr.
Please
John.
ask your GP to give me antibiotics,
Okay,
please.
okay, Mr. John, your concerns are fully recognized. But I would like to assure you in your case that we received your throat swab that is negative for the bacterial infection. So in this case, there's no need for the antibiotic. So are you getting me? What I am explaining you?
Yes, I'm getting. Then what should I do?
Well, I appreciate that you are agree to do something. There's some alternative measures that you can adopt. So may I explain you?
Yes.
Okay, thank you, Mr. John. First of all, you can do the gargles with the warm water and warm water with salt. So, secondly, you can use antiseptic solution also for the warm water. So, would you able to do this?
Yes, I can try. I can try.
Well, Mr. John, and moving forward, also you can avoid some solid food and some spicy curry. So, would you be able to do this?
Uh, yeah.
Well, it's really appreciable that you are willing to do this. And also, you can drink plenty of water, and it will also help to reduce your problem. And in case of any pain, or fever, you can take the ibuprofen. Am I clear to you?
Yeah.
Well, so Mr. John, do you have any other concern?
No, miss, no. I just wanted antibiotic anyway. Thank you.
Well, Mr. John, now at the end, I would like to give you some advices that may be helpful for you. So, may I?
Yeah.
Okay, Mr. John, as I suggest you, as I recommend you some suggestions, if after using these suggestions and all this ibuprofen, if your condition will not be better and you got high grade fever, and if you got some shortness of breath and neck stiffness and like anything that worsening your condition, that time you
Hmm.
can contact to us. So would
Okay,
you be
thank you.
able to do this?
Yes, thank you. Yes.
Okay, do you have any other concern?
No.
Okay, well, Mr. John, I hope, thank you for sharing your concerns and accepting my recommendations. I hope I was able to address your all concerns. So, wish you a good luck and good recovery.
Thank you so much. Thank you. The same problem with nurses. Even I was just, worried. Once you started the role play, I was thinking you are a doctor, really.
But why you asked me? You are doctor. That's why
Because
you.
your way of conversation, way of asking the questions, it was quite professional. It was very good, really, honestly. But
Okay,
but the same
but
problem of nurses asking
okay,
some type of questions again and again. May I ask? May I proceed? May I know? Are you with me? Please, you are the medical professional. You don't need to ask permission of the, you went for 6 minutes. This role play is for 5 minutes. If you eliminate, I will just upload this role play on YouTube and you can watch it again. Okay. When you will watch,
okay.
if you
Then I
just,
will realize my
yeah,
mistakes.
you will, when you will eliminate these irrelevant questions. May I proceed? May I ask some questions? Okay. Should I proceed? May I ask? So many of times you are, if you remove all of these things, then your role
Okay,
play is 5 minutes, is of 5 minutes. It's good role play.
okay,
But please, and one very common memorized phrase for nurses, before moving further, may I proceed? Before moving further, may I proceed? Just please tell the patient what you want to ask. Okay.
okay.
It is
So, doctor,
okay.
there
It
is
is
no need to
natural.
use
It is
this.
these
Okay,
memorized things that reader, the role player will understand. The examiner who will listen to your audio will understand that you have memorized these things. Okay? It is not wrong. You can use one time, two times, but not too much. Okay.
okay,
Your greeting was very good. Your start was very good. Other doctor has started, other nurse, when she started, just she got a problem with connection. She didn't start very well. Okay. She just read this one. May I know the reason of your visit? She just did this, but you have done very well. Okay.
okay.
So you just how you are feeling now, something like that. You have done like you already know the patient. This is very
Yes,
good. Okay.
doctor, because this one is in my settings.
Revisit,
That
revisit
yes,
patient. Okay. We cannot say how can
yes.
I help you. It would look very strange. Okay. That is very good. Then you have asked these questions one by one. That is very good. Then you told me what is diagnosis. Then you asked me what is that. Then you have explained me. I mean, you are involving me in the conversation. Then I asked you, I want antibiotic. You explained me why you don't need antibiotic. But one mistake you have done here. Once you have explained me why I don't need antibiotic, you don't need to jump to your next bullet point.
Yes, yes. Here
You are
I
trying to convince me to start explaining other management. Please
yes.
explain me why I don't need antibiotic, then stop. Just
Okay,
pause. Patient will ask, don't say, are you with me? Do you follow me? These are okay one time, two time, but not overly, please. Okay. Then this is very good. You have done, just you have divided into 2 or 3 chunks. That is very good. Yeah, we cannot tell. This is my own role play. I have written this. So why I have written a lot of information here? Because if you
So
do,
we can
if you
break it.
explain me, if you explain me all of these in one go, I will never give you B grade,
Okay.
because you need to break them. Okay. And then this is when you need to return. Okay. So this was overall very good. Just you, if you eliminate memorized phrases from your role play, and if you keep it natural, you will
Okay,
finish in 5 minutes. Okay. Not in 6 minutes. Okay. So let me
okay,
see if
doctor.
I have noticed anything. How are you feeling? That was very good. And then I think you asked open question. Could you please tell me more? That was good. Yes. Yes. Okay. Do you know what is viral tonsillitis? No, nurse. What is that? Okay. This was your explanation. Okay. Let me tell you that you are in safe hands. Before explaining something, you added also. You are in safe hands. You don't need to worry. Please explain me what is this condition.
Okay,
Okay.
okay, okay,
Don't tell me before explaining. You don't need to worry. Okay. You
okay,
are in safe hands. Please use a
okay.
memorized word. Don't use
Yes,
them. Okay.
okay,
I'm not asking don't use them at all. At one time, two time, naturally it is okay, but don't. Okay. So here you have jumped there. Okay. So then what should I manage? Okay. Okay. You know, you know, you asked me you told me why I don't need to take antibiotic. And then I have seen on my timer that still we have more time. Okay. Then I asked you again about antibiotic. You have to convince me for that.
okay.
Just 1 minute.
Yes, doctor.
Okay. Okay. So, I just
Yes,
got
doctor.
another patient, but still we have time. Okay.
Okay.
So, okay. So overall, okay. So one very good thing in your role play. Okay. So just I was telling that when I saw on my timer, I still had two
Okay.
minutes. So if I ask you to discuss management, then you will finish before 5 minutes. Then I asked you again what I need antibiotics. So you have again spent 20 seconds on that. This is how the role player manage the time. Okay. So you don't need to
Actually, doctor,
jump. You
if
don't
I
need to
have my
jump.
timer with me, then I
No,
am
you will never
managing
have.
according to my.
No, you will never have. The role player will lead you. Okay. The
Okay.
examiner. Okay. You don't need to. So
Okay.
one very good thing in your role plays, first of all, and secondly, this is sequencing. This is very good thing. Okay. First of all, you need to do this. Secondly, this is a very good thing. That is called sequencing. And don't ask, what do you do? Oh, okay. So again and again, you were asking me, what do you do, dad? What do you do to this very rude thing? Okay.
Okay.
You can advise me, but don't ask, what do you do, dad? What do you do, dad? That's please. Okay. So I would advise you to
So I
gargle
was
with
taking
warm
the
and salty
assurance,
water.
reassurance. Like I was expecting that that patient is agree to do this
Yeah,
one.
but not
If I'm
overuse. You have
proposing
asked me two
something,
to three
okay,
times. You asked me 2 to 3 times. You can ask me one
okay,
time.
okay. One time
If
at
you
the end, okay,
just not at the end, at any time, if you wish. This is not obligatory
okay,
also. Just if
okay,
you only pause, I will tell you yes, not, okay. I will tell you.
okay,
Okay.
okay.
So sequencing was good, but don't ask me this. So you asked, you told me advices. No, I will give you some advices. No, advices is no, I forgot. Advice is not
I
plural in
think we can
advices.
some recommendations or some
Recommendations,
man.
pieces of advice, okay, is uncountable. Advice is uncountable. Okay.
Okay, yes,
So
sir.
I will recommend you suggestions. This is not good. Okay. Recommendation, suggestion is same thing. Okay. So overall is good role play. I will give you B grade. Okay.
Thank you, doctor.
But you need to improve some minor
Yes,
points.
doctor.
Okay.
I have my exam on 10th of September.
So you are almost ready, but please still do some practice with your friends. Okay.
Lessons
And
I'm
any,
doing, but I need your time also.
no, I am sorry. Nowadays I'm not taking paid feedback, but
No, sir,
if
like
I
this. If you have free
like, yes,
like session,
yes, in
I will
free
try.
session, yes, maybe in free session. Okay. But at the moment I'm told nowadays be easy. Okay. So thank you so much for your time. Okay. Thank you.
Okay, thank you, doctor.
The last one, Miss, who was, so this nurse has joined again, then she has left again, I think so. Who was doing the role play before you?
No, doctor, she didn't join.
I think she has
She's not
joined.
here.
When we were doing role play, she has joined.
Okay, I don't know. I
Sure,
don't
but she
remember
left
her
again.
name. I think
Okay,
no,
no
she's
problem.
not here.
Okay, no problem. I will do one role play with her, but another time because she has tried to participate in these things. So I will do one role play with her, but offline, okay, with her only. So thank you so much, all of you, for your time. Just please remember these
Okay, doctor.
tips. Please, nurses, please don't follow YouTube memorized questions. Keep it natural, please. Nurses,
Okay.
especially nurses, okay? Doctors are
Yes,
very
sir.
good overall, but nurses, please, okay?
Yes, sir.
And one more thing, in the chat on Facebook, people, you can write whatever you want, okay? Please just don't ask anybody else to don't do anything. If you, if somebody wants to send emojis, whatever, okay? Until or unless it is not emulating some anybody else, okay? It is not judgmental thing. So please help each other and you can answer each other questions and okay. So thank you so much, all of you, for speaking. You must practice with your speaking partners and get some feedback. Okay. And thank you so much. And please give me feedback for this session today. Thank you so much. Thank you, all of you, for participating. Thank you.